Okay, so my care plan ta-da. So how I did it this time is I've got the spider, which is the patient, represents information specific to the patient. I've got the spider web, which has the risks, or has nursing diagnoses on it, and patient outcomes. We're going to support our patient with these. And then the interventions are bugs that get caught in the web, and they're going to help make our patient big and strong and better. And then I've got the pathophysiology over here. Here's my key. Nursing diagnoses are on pink spiderweb lines. Patient outcomes are on green lines. Patient information is in black. Vital signs are in purple. And the interventions are written in green. So, pathophysiology. Patient has multiple risk factors that contributed to her UTI, including being elderly and being female. The UTI led to confusion, and living alone was part of the reason she did not seek prompt treatment. The delay in treatment caused the infection to become systemic, resulting in sepsis. The diagnosis of sepsis is a result of observed fever, weakness, hypotension, orthostatic hypotension, increased glucose and creatinine levels, and electrolytes out of normal ranges. Our patient is an 82-year-old female diagnosed with UTI and sepsis. Her temperature is 101.8, pulse is 110 beats per minute, respirations 24 beats per minute. Blood pressure laying down was 102/50, and standing up was 92/42. Oxygen saturation levels were 98% at room air, and her pain was self-reported at 5 out of 10 on a 0 to 10 standardized scale. My first nursing diagnosis is risk for shock related to sepsis. And the outcomes are that patient will display hemodynamic stability as evidenced by vital signs in normal range for the patient, prompt capillary refill, adequate urine output, and normal mentation before discharge. And our interventions for those are assess for and trend presence of conditions leading to shock, assist with and review diagnostic studies and laboratory tests, assess vital signs and tissue organ perfusion, continue assessment of infection and monitor vital signs and labs, investigate reports of increased pain. Obviously, if the pain is increasing, then the infection is not resolving. Teach patient about medications that they are taking. So we want them to know what they're taking, why they're taking them, when to take them, how much they're supposed to take, and symptoms, side effects that they can expect, and what they need to report. Administer fluids and electrolytes as ordered. We want to get the fluid volume up and get the electrolytes back in balance. Teach diet and rest and exercise for health and immune support. Teach female patients with UTI to drink lots of fluids and void after intercourse, wipe front to back, and take showers instead of baths when possible. Teach importance of keeping perineal area dry and clean, and both of those would be to help prevent future infections. Obtain blood and urine specimens, and teach signs and symptoms to report for timely evaluation and treatment and intervention. If she had known what to look out for and had been able to go to the doctor to get treatment for her UTI before it became septic, then sepsis would not have occurred. And collaborate in prompt treatment of underlying condition. My second diagnosis is acute pain related to urinary tract infection. And our outcomes for that one, patient will report pain as relieved or controlled for the duration of the hospital stay. Patient will follow prescribed pharmacological regimen until UTI and sepsis are resolved. And patient will verbalize sense of control of the response to acute situation and positive outlook. How they respond to the situation and their outlook on the situation affects their perception of pain. Okay, so our interventions for that one are identify specific signs, symptoms, and changes that need evaluation by the healthcare provider. So we want to know what exactly needs to be brought to their attention and when. Evaluate for adverse medication effects. Assess patients' perception of pain, behaviors, and cultural expectations regarding pain. We want to know, what they expect from us and what they expect as far as how they tolerate the pain, how they want to mediate or resolve the pain, things we need to take into consideration for individual patients. Determine medications, alcohol, and other drug use so that we can avoid any unwanted reactions with the pain medications that we administer. Validate the patient's perception and response to pain. We want them to know that we care about them and that we believe them and that we will take care of them. Evaluate and document response to analgesics. We want to make sure that what we're giving them is actually working. And track pain medication effectiveness. So we want to make sure that we're keeping track of both the patient's response to the analgesics and the effectiveness of the specific drug. Monitor vital signs during episodes of pain to see how the body is responding to pain physiologically. Obtain Pqrst pain assessment. Teach patient about the medications they're taking. Again, they need to know what they're taking, why they're taking it, when to take it. And of course we need to administer the prescribed medications. We need to assist with and review diagnostic studies and laboratory tests. Okay, and then our third nursing diagnosis is impaired urinary elimination related to infection. And our interventions, or our outcomes for those, are the patient will demonstrate understanding of condition after education about condition is given and before discharge. Patient will achieve normal elimination pattern after infection is resolved. And patient will demonstrate behaviors and techniques to prevent urinary infection before discharge, as we want to try to keep her from having to come back again. So our interventions are encourage fluid intake, teach female patients with UTI to drink lots of fluids, void after intercourse, wipe front to back, and take showers instead of baths when possible. Teach importance of keeping perineal area dry and clean. Obtain blood and urine specimens. Determine usual daily intake of fluid. Obtain report of previous elimination patterns. We want to know what's normal for her, and observe current voiding patterns. Teach signs and symptoms to report for timely evaluation and treatment, so that she can get back to normal as soon as possible and to prevent further complications. Investigate reports of increased pain. Teach patient about the medications they're taking, and assist with and review diagnostic studies and laboratory tests. Teach diet, rest, and exercise for health and immune support. I think I got them all. Yeah, so that's my client care plan.